Dr. Robert LaLouche, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about voiding difficulties that you might have after a delivery. So, having a vaginal delivery or even after a C-section is a big ordeal for your body to go through, and there are many transitions, and sometimes you can have some difficulty urinating immediately after the delivery or even when you go home. We'll touch on some of the general causes and things that can be done and things to watch out for. So when you are in labor and deliver vaginally, you have some stretching of your vaginal tissues. Your urethra, where is the tube from your bladder to the outside world, it can get stretched a little, it can get irritated and get inflamed, and that can make it difficult to urinate afterwards. It can make it so it burns a little to urinate, or it can make it so that you have difficulty or unable to urinate. If you are in the postpartum room recovering and you find that you haven't gone in a while and you feel the pressure, be sure and notify your nurse, especially if your bladder is filled. It can actually interfere with your uterus shrinking down and increase your bleeding, so you make sure you let them know that. It can be disconcerting sometimes if you can't go pee, and just rest assured that very, very rarely does it ever become a serious problem that can't be resolved. Often what we'll do is place a catheter and let your bladder rest and the swelling go down, and take it out the next morning and see how you're able to go. If you had stitches or tears, that can interfere. Some of the pain medicines can interfere and make it more difficult to go, and that might be a reason for you to get a catheter. Also, the discomfort can interfere as well, and we give you some sprays or topical anesthetics to help with that discomfort to make it easier to urinate. If you have enough sutures or discomfort, sometimes when you get home, if you find it uncomfortable to go pee, sometimes the way that works is to sit in a little sitz bath and fill your bathtub with a couple of inches of warm water and just go straight in the water. Sometimes that gets you over the hurdle. You do have a little higher chance of a urinary tract infection after a delivery. So if you start having discomfort that continues after birth or gets worse, or if you get fevers especially, be sure you notify your physician. Some women do have a little increase in their loss of urine, where they have difficulty holding it, or loss of urine when they laugh, cough, sneeze. That's called stress incontinence. A lot of that will resolve, but it doesn't always resolve fully. So that's something to mention at your postpartum visit. Other things, even with a C-section, you can get issues with urinating. Your bladder is connected to your uterus, and the place where we do the incision on the uterus is right where the bladder is connected. So we actually move the bladder down, and when we do that, that irritates your bladder a little bit. And because it's irritated, if you think of a scab on your knee, every time you move your knee, you feel your knee, you feel the irritations that's there. Well, when your bladder is filling with urine and stretches and shrinks down, it feels that irritation as well, and the signal it sends to your brain is you got to go pee. Bottom line is, after you've had that, you're going to go urinate a lot more frequently, and that will improve over time as your bladder heals up and you re-stretch it out. There is a similar phenomena after a hysterectomy, and there's a whole separate video talking about after a hysterectomy how to retrain your bladder if it has that irritability. Another thing that can happen is some of the medicines, or even an epidural, can decrease your sensation and increase your chance of having some voiding difficulties going pee. But again, that usually resolves with time and improves every day. If it doesn't, be sure and mention that to your provider. Finally is if you have a catheter, if you have an epidural in labor, or when you have a C-section, if you have a Foley catheter, it's a little tube that goes into your urethra, into your bladder to let it drain so that you don't have to get up and back and forth to the bathroom. Well, sometimes that can stretch your urethra out a little bit, or sometimes the baby's head can actually get in front of it and try to push the bulb through your urethra. so there's a bulb that inflates it to prevent it from dropping out, and sometimes that can cause discomfort and stretch things out and lead to difficulties with urination, or even a little blood in your urine afterwards with a catheter. Again, something to mention to your physician if you have some of those symptoms, but it's an explanation for why you might be experiencing some discomfort. So bottom line is, there are a variety of reasons where you might notice some changes, and the goal is to get you back to normal as soon as we can, but something to relate to your physician in the postpartum period, to your nurses, and at your follow-up visit. I hope you found this information of use. Please leave your comments. Thank you.